Welcome to my channel. This is Fibroman, and today we're going to be looking at definition of fibromyalgia and describing symptoms. So this is really the first video where it's going to get into some really good detail based on my experience and not defining based on like a Wikipedia or Google search or something like that, but more along the lines of what I've experienced and a good chance of what you've experienced. So it's going to be a little bit longer video, so I hope it's informational and that it's useful. So what is fibromyalgia? Fibromyalgia is a sensory disorder in the brain that affects the central nervous system, creating widespread pain. The sensation of pain comes from the brain. So a person with fibromyalgia may hear noises louder than they are. They may have ringing in the ears, which is called tinnitus. Can cause hearing loss. I've experienced some of that. They may and usually do feel a much higher level of pain. Low pain threshold is what that's called. Even if they're lightly touched, or even if they lightly touch an object. So there are times I could touch my phone because of my condition with my central nervous system. The phone can actually feel like that I'm getting shocked or like electrical shocks just from touching something. So sensitivity to touch both ways is usually a huge factor. Individuals with fibromyalgia usually have a sensitivity to light, and I have held that diagnosis for quite some time. So being behind a computer monitor can be very problematic. Just excessive light, especially in general, can cause a lot of problems. Again, because we're talking about a sensory disorder there in the central nervous system. So these things happen because there is a problem in the volume control in the brain. So it can cause the person with fibromyalgia to feel very overwhelmed and agitated. Widespread pain is associated with fibromyalgia, affecting the muscles and the joints. Muscle spasms and sometimes seizures can occur. Fatigue is almost always associated with fibromyalgia. The symptoms may occur on occasion in some individuals. Other individuals like myself can have symptoms all the time with flare-ups that even somehow make things worse. Fibromyalgia can be debilitating. So the person's brain who has fibromyalgia usually sends pain signals such as pinpricks, stabbing, burning, crawling sensations, numbness, etc. to random areas of the body. They can come and go or change to something else. They can hit you sharply all at once and immediately go away, or they can decide to hang around for a while. It's so unpredictable. Cognitive issues, including memory problems and difficulty concentrating, are usually associated with fibromyalgia. Severe depression is often associated with it. Since individuals with fibromyalgia have a low pain tolerance, any existing health conditions will also feel much worse. For example, if you have neck or back pain, it's going to elevate that pain level tremendously. Especially if you're dealing with osteoarthritis. So unfortunately I have all of that, so that might explain why the pain level for me is always so high. So sleep disorder is also common with fibromyalgia. Bladder and bowel problems are also associated with it. So understanding individuals who have fibromyalgia can be challenging because to everyone else, our symptoms are simply invisible. So it could be difficult for doctors to diagnose. There is no standardized diagnostic testing. So although that is very hopeful, I would say for the future, but as of right now, if I'm correct, there is no standardized diagnostic testing. So what happens is doctors need to make sure that they're treating the right thing. So unfortunately, you have to endure being referred to a specialist after specialist, testing after testing. Have you been there and done that? So to say that this can be overwhelming is surely an understatement. Also, many health professionals are not educated about fibromyalgia. There's a tendency to misdiagnose the person's symptoms as simply psychological. How many times have you been psychoanalyzed regarding your symptoms or your condition? So it can make you feel like you're losing your mind. Fibromyalgia diagnosis and treatment seem to fall into the gaps. So before my diagnosis, I was bounced back and forth to numerous neurologists, then to a rheumatologist. Some doctors simply don't believe in fibromyalgia, and it was the rheumatologist that told me this, which to me seems pretty bizarre. I could read between the lines there. So I had a neurologist one time tell me that what I needed was group counseling. That's what my problem was. So that was a neurologist. So she was the one who referred me to the rheumatologist and assured me, the neurologist assured me that my issue was not neurological in nature. And obviously we know that that is, and that was not the case. So the guidelines for diagnosing fibromyalgia in the United States come from the American College of Rheumatology. However, when I went to the rheumatologist, they wanted nothing to do with it. The testing that a rheumatologist should use is called the Widespread Pain Index, WPI. 2010 is when that came out, I believe, and revised again in 2016. But back in 1990, the American College of Rheumatology came out with the idea of like tender points. So if a patient had 11 of 18 tender points, they could receive that diagnosis. That proved so ineffective because people who have fibromyalgia have such a variance in symptoms. So one day it could be there in 3 parts, another day could be in 5 parts, another could be 10, 11, so that just did not work. And the fact is, the tender points are pretty much tender on any person that you try to grab that muscle or whatever to diagnose that. So just the WPI is a lot more effective. Let me see if I can actually bring that up here. I'm not very good at using the technical stuff here yet, but I'm trying. So I don't know if you can see this or not. I sure hope so. If not, I got to go with this video because I think sometimes I can only do this maybe one time, but it kind of gives you an area, different areas of your body, and they're looking for bilateral pain in the lower and the upper level. And so it's something that a patient can fill out and would be very useful for a rheumatologist or a provider to use this. A lot of somatic symptoms, and then it comes up with a score. I'm not going to get into all the detail of this, but I just want to show you, and it's easily available on the web. All right, so the bottom line is that fibromyalgia is a central nervous system disorder that can impact every area of our lives. There's no cure. That is why fibromyalgia or pain education is so important. We need to be educated and know what we're dealing with and learn how to manage our symptoms. I believe that knowing your diagnosis is half the battle. When you don't know it, it can become very frustrating as we're reaching out for help, trying to understand what in the world is happening to us with all these dreadful symptoms. So I know that frustration all too well. If you're watching this video right now and you're going through that period of frustration, hang in there, please, and keep working with the doctors and learn from each experience, even if it may have been a negative experience. Try to learn from it, and as I look back, I realize that I have learned some things from each step of the way. So you want to know simply where you belong with your condition so you can get some type of treatment and support. So let's keep encouraging one another to continue to spread awareness of fibromyalgia and other chronic pain conditions. Thanks for watching. This is Fibroman signing off. Until the next mission, please show your support by liking this video and subscribing to my channel. Thank you very much.